Hi, my name is Alexa Rossum, and today me and Dodi are going to be talking about some common sleep disorders, what causes them, and how to prevent them. First, we will give a basic breakdown regarding the sleep cycle and circadian rhythm, sleep debt, and the misconceptions of sleep. Then we will go more in depth into these two common sleep disorders, insomnia and parasomnia.
Furthermore, let's go over some basics about sleep. A sleep cycle is a period of time during which a person moves through several stages of sleep, typically lasting around 90 to 110 minutes. During the sleep cycle, a person typically experiences a combination of non-REM sleep, rapid eye movement, and REM sleep. Non-REM sleep is further divided into several stages, including light sleep, deep sleep, and transitional stages. Each stage of sleep has unique characteristics, such as brainwave patterns, muscle activity, and eye movements, and serves as important functions for physical and mental health. The length and number of sleep cycles a person experiences can vary depending on factors such as age, sleep, habits, and health conditions. In order to get to sleep, we need an internal clock for sleep because it helps regulate our sleep-wake cycles, also known as our circadian rhythms. Our internal clock, which is located in the brain, helps determine when it's time to go to sleep and when it's time to wake up. Now let's get into sleep debt. Without having a consistent sleep cycle and rhythm, we are essentially not getting adequate sleep over a series of days. This causes sleep debt to progressively build day by day. For example, a person needing 8 hours of sleep but only getting 6 would build a sleep depth of 2 hours that day. A person with an 8 hour sleep need who only gets 6 hours for 5 days builds a sleep depth of 10 hours. This causes a person to feel drowsy physically and mentally, which is insanely dangerous. Drowsiness, which so many of us have experienced while driving, is not a sign of being a little tired, but is actually a red alert because it is the last step before actually falling asleep, not the first. Meaning so that when you're behind the wheel, maybe driving a car on the highway, drowsiness actually means you're seconds away from a disaster. If everybody responded as if it were an emergency when they became drowsy, an enormous amount of human suffering and catastrophic events would easily be avoided. Seconds away from sleep means seconds away from death. Drowsiness is a red alert. Now let's get into some misconceptions about sleep. Now you may be thinking, how do I feel so drowsy? While napping can improve some temporary relief from sleepiness and help improve cognitive function, it cannot fully compensate for the sleep that was lost throughout the night. Sleep is a complex psychological process that involves various stages and cycles, and the body needs a certain amount of sleep, restorative sleep, in order to function properly. Napping may help improve alertness and cognitive function, but it cannot fully replace the restorative benefits of a full night's sleep. In fact, relying on napping to make up for lost sleep at night can actually lead to a vicious cycle of poor sleep habits, and it also can make it harder to fall asleep at night, which leads to more sleep deprivation. It is important for us to prioritize getting enough sleep at night and also to establish a consistent sleep routine in order to maintain overall health and well-being.
Now that we have an understanding on sleep and the effects of not getting enough sleep, I will be talking about common sleep disorders that affect nearly 70 million people in the United States. First off is insomnia. Insomnia is when an individual has trouble falling asleep, staying asleep, and can't get good quality sleep. Some types of insomnia include transient insomnia, which is when it lasts less than a month, short-term insomnia, which is between 1 and 6 months, and chronic insomnia, which lasts more than 6 months. What can cause insomnia? It's not always clear what triggers insomnia, but it's often associated with stress, anxiety, poor sleeping environment, lifestyle factors such as jet lag, drinking alcohol or caffeine before going to bed, and genetics. All of this can have a negative effect on a person's mood, energy, concentration, and overall well-being. Ways to prevent insomnia. In order to prevent insomnia, an individual can stick to a sleep schedule by keeping their bedtime and wake time consistent from day to day, including on weekends. Staying active, limiting screen time before bed, avoiding naps, avoiding or limiting caffeine, alcohol, and nicotine, and also avoiding large meals and beverages before bedtime. Now, more serious form of a common sleep disorder includes parasomnia. Parasomnia is when an individual experiences abnormal movements, talking, emotions, and actions while they're sleeping. Some examples include sleep terrors, sleepwalking, nightmare disorder, sleep-related eating disorders, and sleep paralysis. What can cause parasinomias? Parasinomias often runs in families, so there may be a genetic factor. Another cause are brain disorders, such as some cases of REM sleep behavior disorder. Parasinomias can also be triggered by other sleep disorders such as obstructive sleep apnea and various medications. Ways to prevent parasinomia and treat it. Many people who suffer from parasinomia see an improvement in their symptoms simply by improving their sleep habits. Good sleep habits include keeping a regular sleep schedule, managing stress, having a relaxing bedtime routine, and getting enough sleep. There are also some drug therapies that are used to control symptoms. Some people also have gone the psychological approach, such as hypnosis, relaxation therapy, or cognitive behavioral therapy, and psychotherapy. Thank you for allowing us to give you more insight on sleep. Here's our information, and if you have any questions, now is the time. Here's our source page. Thank you.